Welcome to Nurses with Voices, the podcast where we amplify the voices of nurses everywhere. I'm your host, Dr. Lindra James, DNP-RN, and I am thrilled to go on this podcast journey with you. As a nurse with over 20-something years of experience, I've witnessed dedication, resilience, and passion that defines our profession. Through this podcast, we aim to educate, empower, and inspire nurses at every stage of their careers. Whether you're a novice nurse navigating the challenges of bedside care, an experienced clinician looking to advance in your field, or dreaming of becoming a nurse entrepreneur, Nurses with Voices is here for you. Join me as we delve into topics such as advancing in nursing, mastering leadership skills, and fostering a supportive community within our profession. Together, we'll explore the triumphs, struggles, and countless opportunities that come with being a nurse. So tune in, subscribe, and let your voice be heard, because here at Nurses with Voices, every nurse has a story worth sharing, and every nurse voice deserves to be amplified. Right. Well, we are live and welcome back to another episode of Nurses with Voices. I am your host, Dr. Lindra James, DNP-RN, and I am excited to have Dr. Linda Logan here with us today. So before we get into that, let me just mention that our episode today is sponsored in part by NOLA, the CRM of your choice. And NOLA is also sponsoring our Health and Wealth Expo, a virtual summit. It's a 2-day virtual summit. And Dr. Linda Logan is actually going to be a guest, a panelist, I should say, on the during the expo. So I am super excited to have her here. So we're coming to you guys live because I wanted you guys to get a sneak peek, I should say, into what you're going to be listening to on Nurses with Voices. Our series right now is talking about and leading up to the Health and Wealth Expo, the virtual summit. And, if you're listening in, Nurses with Voices is now available on iHeartRadio, Amazon Music, Spotify, YouTube. So we're really, really, really excited about it. So we're going live today to show you guys what we're going to be talking about on these episodes. And again, just talking about leading up to the Health and Wealth Expo. So without further ado, I want to go ahead and allow Dr. Linda Logan to introduce herself. So, Dr. Logan, welcome. Thank you so much for coming today on the show. And I have a lot of questions for you. So, mental health and nursing is something that is, super, super, super important. And it seems as though mental health has always been something that's really, it's been huge. However, it's since COVID, and this is my opinion, right? Since COVID, it's been a really, it's been an awakening, I would say, with mental health. So can you share what was your journey into being a mental health nurse practitioner, and what made you choose that path?
Thank you so much, Dr. Lindra, for having me here on your podcast, Nurses with Voices. Oh my goodness, amazing. Well, it's a privilege to be here. Once again, my name is Dr. Linda Logang. I am a doctorate prepared family nurse practitioner, psych mental health nurse practitioner with over 2 decades of nursing experience. My background is in emergency medicine. I worked for 13 years in emergency medicine. For the past 3 years, I've been in psychiatry. So I am the owner and provider of my mental health clinic, Lind Health LLC. And that's what I do. And I live and breathe mental health. Well, like you said, Dr. Lendra, before COVID, right, mental health has always been there, right? I work in the ER. We do have a mental health unit, holding unit in the ER. There isn't any day that goes by without me as an ER provider take care of a patient with any type of mental health issue, depression, anxiety, psychosis, you name it, right? So it's ever been there, always been there. But since after COVID, there was a surge of mental health priority, has a priority, because in life, what happens, like, as we go through life, we build unhealthy habits to try to overcome those any mental health symptom, right? It's a symptom and it becomes a disorder. So we do have a lot of those symptoms, and we're trying to unhealthy habits, maybe wait for a crisis in order for us to take care of it. So that's why, as an emergency room provider, when they're in crisis, why they come to us. So during COVID, um, the, the symptoms that was using busyness to kind of overcome, and different things, you couldn't do that busy life, right, to overcome those. You couldn't do the things that you usually do to try to overcome the symptoms, and it became a disorder, and it became a very chronic disorder. So people couldn't hide it, right? It has to come to light. They needed help. And then, because it was a lengthy time during COVID, then it was just, so there was a surge of people suffering from mental illness, and they couldn't really cover it, why they needed help. So there was a huge surge of mental health patients, and even us as providers. It became more important, even for us as nurse practitioners, to go join forces with with other healthcare providers to take care of mental health patients. So usually mental health patients were taken care of by primary care doctors or BGYN. Usually they, when in crisis, they go to urgent cares clinics. So those places were all closed and locked. So then came the need of having more and more providers out there to take care of mental health patients. So that's where I come in place.
I love this. Mental health is an important component of healthcare in our daily lives. I'm as you're talking, I'm thinking back to when I grew up. You didn't really talk about mental health, right? Our parents didn't identify it, they didn't recognize it. And I think, and you probably can, as the expert, you can correct me, we didn't really diagnose children, right? Like even with autism or with schizophrenia or bipolar, these things were just not really, they weren't recognized. And when coming from where we grew up, it's not funny, but you didn't recognize and you didn't talk about something being wrong with your brother or your sister or your cousin, or you didn't talk about it. It was like, oh, they just need to go outside and play, right? Or, that it wasn't really recognized. And even in the professional society, they didn't diagnose individuals properly. So what are you finding now? And what are your thoughts on that?
Well, that's a great point, Dr. Landra. It's still taboo. It's still a stigma. There's still a stigma in mental health for patients and providers. And I remember when I was in my journey of becoming a psych mental health nurse practitioner, and then people were asking me, well, what mental health? And I was like, well, because it's something that I've been called to do, and I have the mental and spiritual strength to do. And it's like, well, why are you doing it? Because usually providers who take care of mental health patients, they become mental health patients themselves. So there is still that stigma, and people do not know that our brain is the gas, and the mental health is a gas gauge, right? It's such a huge part of everything. So I'm going to read a definition by the CDC. It says mental health includes our emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. It also helps determine how we handle stress, how we relate to others, and how we make healthy choices. So mental health is important in every stage of our life: childhood, adolescent, adulthood. That's by the CDC. And like you said, when you're a child, when you have symptoms, right, at the time of depression or any type of mental health symptoms like depression or anxiety, or don't want to get out of bed, or you're anxious, you may have panic attack. Well, like you said, well, why don't you just go outside? Why don't you just talk? Or why don't you just, right? It wasn't something that was as important, right, as going for your physical exam, right? As children, you go for your eye exam once a year, you go for your physical once a year, and then you get all these shots and for your physical. So mental health, it wasn't really that important because it's taboo, right? It's still, or it's not that big, it's not a big deal, right? Why don't you just like cover it up? Because it's a stigma. People are going to think that my child is depressed. People are going to think that my child is anxious, or that they're abnormal, right? Because of that stigma, they still feel, well, if you have a mental health issue, then you're abnormal. But it's not as different as having hypertension or having diabetes. It's just a disease of it's a different disease. So then, yes, so you have to, that's when it comes, we need to break that stigma among healthcare workers and among our patients. So that comes, and that's why I'm here. So that's, part of my mission in life is to make sure that I educate healthcare workers on how do they identify mental illness for themselves, and how do they identify with their patients, and how do they really educate also and bring awareness, because you just don't know what you don't know. Whatever you believe in, whatever you've heard, and whatever you've lived. So we do have to take an active a role into breaking that stigma nowadays.
Right. I see a lot of people are concerned with certain diagnoses going onto their health record, right? And, what happens is they may not get insured moving forward if they have certain diagnoses on there, whether it's depression or whether it's anxiety, they're concerned about that. Do you want to talk a little bit about that and what you've seen, or?
Yes. As far as it's insurance, unfortunately, if you do have some mental health issues, you will be declined, right? If you do have, but not necessarily declined, but it depends on the extent of that mental health issue, right? So if you are depressed, like I said at the beginning, it's a symptom, right? It's not a disorder. So it becomes, you may not feel well, your mood is low, energy, and so a lot of times, like we tend to like cover it up, right? As you cover it up, what happens? It's never gonna go away. It's still there. So as you get into like maybe a stressful environment, because life happens to us, like at any stage of our lives, life happens. Even for children, life happens, right? They can lose a friend, they can lose a parent, or something can happen. So when that crisis comes, that symptoms is gonna become a disorder. So it becomes persistent, right? And it is when it becomes persistent that cannot be hidden, right? It cannot be hidden. So and so that's why we do, as providers, we do have to educate, right? We have to educate the community to what are the symptoms and what is it, take an active role into bringing an awareness. So if you're feeling this way, you need to be evaluated and see, and then seek help, because it's never going to go away. It can only get worse.
That kind of leads me to my next question. I'm just wondering, what is one of the most common diagnoses you've treated, and how do you approach that diagnosis and treatment? It sounds like you said awareness is one, but how do you approach that diagnosis and treat it?
Well, how do you diagnose? Like you said, a lot of times, when you have a child, let's say an adolescent, a child, and usually at younger age, you will notice like symptoms of depression, like the common diagnosis for in childhood, on adolescence, or in adulthood is depression and anxiety. So they are the most common one. And of course there are other ones, for younger, usually ADHD. Early on also some children have autism, so you may notice some symptoms like something is different, right? There's a change of energy, there's fatigue, right? They can't seem to get out of bed. They can't focus, right? Because there's low mood, you can't focus, it's hard to get up in the morning. Why? The child, sometimes it's, oh, he's not a morning person, right? They're having a hard time. Maybe they were not, and now they're having a hard time getting up. A little bit restless. Sometimes they just rest, increase energy. They may be hyper focus on something. The speech pattern. Sometimes they speak too loud, or maybe they speak too low now. Different habits, right? Disruption in grooming. They may not go and shower. Now they don't take care of their hair. They can't, they're not sleeping anymore, or maybe they're waking up all the time, and maybe they're awake all night doing different things, right? Changing physical body, weight gain. So maybe weight loss too, because when you're depressed, sometimes you don't want to eat. Sometimes you just, and then for somebody with worse anxiety, you may have what we call a panic attack, where you have this intense episode of chest pain, your hands are numb, you're dizzy, sometimes you pass out. And so a lot of those symptoms, like GI, some people have like they have like stomach pain, they're constantly complaining of diarrhea. Well, that's anxiety, right? So social interactions, they may not want to go. They used to hang out with the neighbor, or maybe go and do some type of activity with their friends, or after school activity, boys and girls club. They don't do it anymore. They don't want to go. As an adult, you don't want to hang out. You don't want to go to a party or to an event. You don't feel like you want to go there anymore. You feel drained. You feel tired. It takes energy for you to be around people. Humans are social beings. So we love to be around people. So once you feel like it's a strain for you to be around people, then there's different, right? And there's resistance too, very irritable when you have to do something. We have to, any type of change, you become very resistive. So it's a lot of those symptoms that are signs of anxiety and signs of depression, right? And you're avoiding to go in places. Some people have social anxiety. They don't want to go when there's an event, like going to watch a movie, or maybe go to an event with family. They may not want to go, right? And it's like, oh, you just don't want to hang out with them. No, that's because they're anxious. They have social anxiety, or maybe they're afraid of having a panic attack in front of everyone. So those are signs of that you may notice in your child, you may notice in your husband, you may notice in your wife, you may notice in a parent, that will actually say, hey, they need to be checked. Maybe they need to see let your primary care doctor know, if you've experienced it before. So like as a provider, I do have patients, and I see that, and they recommend that the husband, they recommend the son or the daughter, because they've had it before. So for some people, they've had it, if they've been diagnosed with anxiety and depression, if they notice those behaviors in their loved ones, so they know. Usually they may just make an appointment with like a mental health provider to be assessed, and then if they're diagnosed with any disorder, and then maybe the treatment plan. So a lot of times also, Dr. Landra, people, right, have had a history, like a negative history. Maybe for themselves, they've been on medication, they've had side effect, or maybe something happened, so they're afraid. And then because they've been not ask for help, or they don't want help for their loved ones because of their experience. So and then it delays the care for that loved one. So everybody needs to be aware, not just the direct family. It could be the teacher, it could be the counselor. So we all need that education. So somebody needs to do something if they notice them.
I completely agree. I want to shift gears a little bit and talk a little bit about how, mental health and nursing itself. What are some, things that you've seen, right, in mental health with nursing, right? I'm talking working in the traditional setting, working as a bedside nurse, working as a nurse leader. What are some mental health issues you've seen? I mean, I'll share. I know for a fact myself, I can remember working as a nurse leader at an institution. And I never forget one of the educators came up to me and said, if you ever need some Xanax, I keep some. And I'm just like, no, I'm fine. Like, I never really thought about it, but I'm okay. But apparently, like, this was like a thing. I mean, I don't know. I'm not saying any names. I'm not saying any settings, but apparently this was a thing. So, there is a lot of anxiety that goes on in nursing. I mean, I've had nurses tell me that they get anxious just knowing they have to come in for their shift. Because nursing has changed so much, right? It's so there's a lot of, mental health, right, needs within the traditional setting of nursing. Do you want to speak a little bit about that?
Yes. Oh man. So we've been out there, right, in the healthcare field for 2 decades, you and I. And I know we met early on in our nursing career. So yes, we've been there, right? We know like it. And so nursing, so you work in an environment where there's a lot of stress, constant stress, wherever you are. We're taking care of people who are vulnerable, people who are sick. And then when you're sick, your behavior changes, right? When you're sick, you're not acting something sometimes rationally. If you so us as the provider, we are the first person to experience those changes. So as your patients and then your leaders, they come with, you're being hit by different things. As a nurse in a setting, either a patient or a patient, you're dealing with the family, you're dealing with the patient, you're dealing with the provider, you're dealing with the social work, you're dealing with the manager, you're dealing like that's you're in the middle. So you are dealing with constant stress from all of those people. So as you working, if you don't develop strategies to help you deal with that, it's gonna compound, and then it's gonna lead into anxiety, it's gonna lead into depression. And then as the night shift nurses, I know you and I, we worked at night, you do have that night shift disorder, right? And so it is high stressed environment. And us as nurses, we kind of learned how to thrive, I guess, in that environment, because we love what we do. So we have a passion, we really truly care. And then that passion and that drive, I think, allows us to kind of deal with that. But not everybody can deal with that, right? That's when sometimes they need, like you said, a little Xanax, right? So they can calm down, or happy pill, when they have a low mood. So yeah, it's a huge, definitely huge in healthcare. But because it's a stigma, right? People don't want to be seen as somebody with anxiety, and people don't want to be seen with somebody with like depression. And then people don't want to, and then compassion fatigue, while you're constantly giving and giving and giving and giving. What about you? Right? What about you? So yeah, so definitely in healthcare, those like depression, like anxiety, those two ones that
Mhm.
the most, usually healthcare workers deal with a lot of that. And then people working at night, they do have that night shift disorder.
Do you want to talk a little bit about that? The night shift disorder. Just elaborate on that a little bit.
So, me as a provider, when I worked at night, I I worked for 10 years. So the 10 years I was working at night, it seems like a blur to me. Definitely like a blur. So when I switched from night to day, it seems like everything became, it's like I was living again. So I was like, oh my God, I love, it's so beautiful outside. I love the leaves. And then in the winter, oh my God, let me take pictures. It's so beautiful. Like, what? It's been 10 years. Like, what's going on? And now you're enjoying the fall and you're enjoying the winter, right?
You weren't used to
So,
that.
so I was like, so that's an example of what exactly it's like night shift disorder, right?
Mhm,
So
mhm.
it's a physical consequences of working at night. So when
Right.
you work at night, there's a couple of your circadian rhythm, it's not where it needs to be. You're supposed to be asleep from 10 p.m. to 2 a.m. and then your brain rest, and from 2 to 4 or 5 or 6 when you wake up, your physical body rests. So you're not able to do that. Your circadian rhythm, it's out of whack. You have a disruption of one of the important things that your body needs to function. So as it becomes disrupted, you have those neurotransmitters that are also going to become disrupted. You have leptin, the levels is going to be not where it needs to be. And of course, as the leptin levels, it's disrupted, and then serotonin and then dopamine levels like all over the place, then what happens now? Now your ability to um, uh, um, know how to metabolize certain things are out of whack. Body fat, your appetite, you start eating a lot, and now goes with obesity, now go with diabetes, now goes with hypertension, right? So that's those are some of the results of night shift. And then also, as you do that, you're not sleeping as much, so you start having low mood, or maybe whatever you do during the day, you can't go to some certain events, or when you go there, you're like sleeping, like sleepy all the time. So now, you have a mixing of anxiety, a mixing of sleepiness all the time. Like, you work nights and during the day you're sleeping. It's like you cannot function during the day like a normal person. You're always sleeping. Either you're dozing off or you're just not physically there. So that's why, as I transition into my to working days, it was like a blur. I was literally living like my whole 10 years was like a blur.
Right.
So yeah, some of some of those said, and then we learn to live with it. The obesity sets in, metabolic disorder sets in, cardiovascular disease are setting in, so mood changes, symptoms become disorder. Now we're depressed, now we're anxious, now we're sleeping all the time, insomnia. So all of that, that's a night shift disorder.
Right, right. No, you that's and I hear rectal cancer as well, right? I hear like that's one of the cancers that we're for night shift, people who work night shift. I hear that. And I forget it was an article that I read long ago when we were working nights that had talked that had talked about that cancer was one of the things that in dementia
Yes.
as well.
I mean,
Right.
there's so much, and
Yeah.
not to mention, I forgot to mention an important thing: safety, safety, safety.
Safety is huge.
Like, risk of accident. I remember one day I worked. I was going home, and I stopped on the light at the light so many times, and I fell asleep.
Mm-hmm.
Really, I slept.
Mm-hmm.
Somebody
Yep.
bing, bing, bing behind me, and I woke up and I was like, "Oh, what's going on?" And then also one day I drove home and I parked in front of the house, and
Mm-hmm.
I don't remember. My mom came like maybe an hour later and knocked at the window.
Mm-hmm.
I really
Mm-hmm.
do not remember from when I was taking my last turn coming into my apartment, and then that's all I remember. And
Right.
I went to sleep. Right,
Yep.
safety is huge.
That w-
Connecting function is completely out of whack, impaired.
yeah, that was when I knew it was time for me to go to day shift or come off night shift. It was the safety aspect of it. I can remember waking up because my car hit a like I last thing I remember was being on the left lane on 80 and waking up. I had come off the exit. That mean I crossed all of these exits and I had come off the exit. And the thing I was driving a truck at the time, and my truck hit the curb, like it was one of those high curbs. Didn't do any damage to the car or anything, but it just woke me up. And I said, oh, that was nothing but God, right? Like that was
Yes.
just, and that was then that I knew, okay, it's time to come off night shift, along with everything else that you just mentioned and experiencing. Like I knew then it was time to come off night shift. But yeah, so now you actually help other nurse practitioners start their practice, right? Isn't that what you're doing? You want to talk a little bit about that and say what you're
Oh
doing with
yeah.
that?
Yeah,
Yeah, and
that's my
you have
sweet
a
spot
group.
right there. Yes. That's my sweet spot because like we've just mentioning, about mental health and then how to deal with mental health. And so a lot of times when you do have something happening to you in life, you got to decide, um how do you solve the problem? You change the solution, you avoid, or you get out of it, or you just feel better, you feel content, you try to regulate it as much as you can with maladaptive behaviors. Are you going to just tolerate it, or are you going to stay in the problem? So as in my journey of really, uh, we go through all of those hurdles of working nights, being overworked, and of course being underpaid, and not really having time, right? So a lot of times you just said something important. What was the straw? What made you take a leap? It's like, I'm done with nights, right? So so for me as a provider, I had that straw, right? After COVID, where things were crazy, and I just reflected on my journey as a nurse practitioner. What has it been? Of course, I loved it. I loved what I did every single day, but there were other things that I didn't like, right? And everything just came rushing. Well, I have to ask permission if I want to spend time with my daughter, my son. Missing a lot of events, missing birthdays, missing holidays, having to ask for permission for anything, being overworked, and being underpaid, and not really practicing at the scope of my practice, and not really having the freedom to express some ideas. And I'm a learner, and there was no room for that. There was no room for independence in my practice. And I became to search and look, how can I solve this problem? Is there something better for me as a provider out there? And then as I went into that journey and I opened my own practice, and then since I like to learn and I like to share, and I was like, why is not everybody doing this? Like, what? Why do they have to just ask permission? Why can't they just be on their own and then be free?
Right,
And they can
right,
make
right,
as much money as they want. They don't
right.
have to, like I was like, this is the solution.
Starting a business is almost like a best kept secret. Starting your
Yes,
own business.
it's a
Yeah, yeah,
secret.
yeah.
But also as nurses, we've never taught that in school, in our RN curriculum, in our nurse practitioner curriculum. It's never even discussed, like opening your own practice, or no, right? Sometimes you see other people, like you heard of people having their practices, but you don't really see yourself. People that look like you, they haven't done it. So at that moment when I discovered, it was like a light bulb. I was like, why don't like just asking, and as I went in, even as I opened my own practice, it was not easy because I was looking for help. I was looking for advice. There was no help, there was no advice, there was no mentorship, nothing. Literally, but I had time under my hands because my mind was already made. Power of
Mhm,
a mind being made. I like that you had that straw and said, that's it, I'm done. So I had that
mhm, mhm.
fire, of like, let me try to figure out, if you can't get it for me, let me get somewhere else. Like, you can't, okay, let me go. So I figure it out on my own. And how can I create how can I create an army of us, knowing this is all by sharing, right? That's when I started to say, I need to share. Let me find different avenues to share what I've learned in my journey of nurse practitioner entrepreneurship. And also, as I have a lot of us out there, guess what? Our impact will be bigger. One of my straw, that I had in an emergency room, my impact was only in one room with this one patient. So I wanted a bigger impact. I wanted to impact my community. I wanted to impact many communities to, so as I stepped into entrepreneurship, I'm like, wow. So I get to do all of that. And guess what? Not only me, but me and other providers, we get to impact the whole world, right? The whole US. So that's, what I'm doing right now, empowering and giving practical tools that helps nurse practitioner open and thrive in their own private practice.
Well, there you have it, everyone. Dr. Linda Logan, she will be a panelist discussing more at the Health and Wealth Expo. Make sure you guys register and attend at www.healthandwealthsummit2024.com. You can see Dr. Linda Logan, the Health and Wealth Summit. The expo will be on March 23rd and 24th from 11 a.m. to 4 p.m. Please register so that you can get more and receive more of these great insights. Dr. Logan, please let the audience know how they can contact you.
Yes. So I'm an open book, right? I do have I do have I'm like an open book. If anybody wants to get in touch with me, I have my phone number 347-209-0881. If you have anyone who needs mental health consultation, I do give a free 15 minutes consultation. It could be you, it could be your child, it could be a family member. Dial this number, text this number, and I'll be able to, schedule an appointment with you. And also, please, you need to come at this Health and Wealth Expo, because I will be sharing wellness toolbox that you've never seen, never heard of. So you need to be there. Definitely, you need to be there. You do not want to miss it.
You do not. I think it's such a great lineup. You guys are going to be so awesome. So thank you so much for this episode, for coming on today. I appreciate you so, so much. All right. And so everyone, until next time, stay educated, stay inspired, and stay empowered. And we will see you in the next episode.
Alrighty. Thank you.